NMDA receptor encephalitis is a paraneoplastic neurologic syndrome. It presents with a mix of psychiatric and neurologic symptoms, including psychosis or behavioral changes, memory loss, seizures, abnormal movements, dyskinesias, autonomic instability, fever, blood pressure swings, speech problems. It is strongly associated with ovarian teratomas, especially in young women. NASH chat, USMLE style question 1. A 21-year-old woman is brought to the emergency department for confusion and bizarre behavior. Over the past few days, she developed hallucinations, short-term memory loss, and involuntary facial movements. She now has a fever and fluctuating blood pressure. EEG shows diffuse slowing. What is the most likely underlying cause? A. Herpes simplex virus encephalitis. B. Multiple sclerosis. C. Anti-NMDA receptor encephalitis from ovarian teratoma. D. Wernicke encephalopathy. E. Autoimmune thyroiditis. Correct answer, C. Anti-NMDA receptor encephalitis from ovarian teratoma. Explanation. This young woman has psychiatric symptoms, memory loss, dyskinesias, and autonomic instability, classic signs of anti-NMDA receptor encephalitis, often associated with ovarian teratomas. Why not the others? A. HSV encephalitis can cause confusion and seizures, but usually shows focal findings and temporal lobe involvement. B. MS? Chronic disease with focal neurologic deficits, not acute encephalopathy. Triad is confusion, ataxia, and ophthalmoplegia, not this picture. E. Thyroiditis can cause neuropsychiatric symptoms, but not with seizures and dyskinesias. USMLE style question 2. A young woman with acute psychosis, seizures, and dyskinesias is found to have anti-NMDA receptor antibodies in her cerebrospinal fluid. Which tumor is most likely to be found on imaging? A. Medulloblastoma. B. Meningioma. C. Ovarian teratoma. D. Pancreatic adenocarcinoma. E. Small cell lung carcinoma. Correct answer, C. Explanation. Ovarian teratomas are the classic tumor linked to anti-NMDA receptor encephalitis, especially in young women with neuropsychiatric symptoms. Why not the others? A. Medulloblastoma, seen in children not linked to this syndrome. B. Meningioma, benign tumor, not associated with paraneoplastic syndromes. D. Pancreatic cancer, not linked to neurologic paraneoplastic syndromes. E. Small cell lung cancer, associated with Lambert-Eaton or SSIADH, not anti-NMDA encephalitis.